Hey there, and welcome to the Fiihr Factor, the podcast that shines a light on real stories, smart strategies, and the occasional hard truth about running a business. Think of this as your quick dose of clarity before your first cup of coffee. Let's go. Today, I have the pleasure of interviewing and learning from Dr. Cristin Dickerson. Thank you so much for taking the time today.
Happy to be here.
Well, it's awesome. I'm so intrigued to hear how you saw a need and you took this need and made it and built it into a company and have obviously helped a lot of people as well through the process. So, can you just give me a little background on your business and how you got started?
Sure. Interestingly, I started my career at Diagnostic Clinic of Houston, a big multi-specialty group in the Texas Medical Center, because I never wanted to get into the business of medicine. I just wanted to practice medicine. And then a few years of being there, we had a new business office manager who brought me this box of what we called yellow tickets. And they were basically the receipts for the work that we did at the hospital. So my nights, weekends away from my kids and my family, were spent generating these yellow tickets. And the hospital wasn't giving us enough information to bill for those and enough
Hmm.
demographic information. And so I quickly got involved in the business of medicine and ended up being the managing partner of that big multi specialty group. And it kind of segues into this because I was running a health plan there for our employees. And it was a self
Okay.
healthcare plan, which is what, those are the people that my business primarily helps at this point in time. And so down the line, that multi specialty group made an arrangement with a hospital and ended up kind of negotiating giving up their own imaging center. And by that time, I'd founded a radiology group. The radiologist from Diagnostic went on and, practiced in that radiology group. But I would get phone calls from friends and they would say, do I really have to pay $3,000 for this MRI? And the answer at that point in time was yes, because River Oaks imaging had been purchased by Memorial Hermann. Prices, doubled, tripled overnight. And
Oh.
there were very few in-network imaging centers at that point in time that were not owned by a hospital. And then the ones that were operating out of network. People still had good out of network benefits. And, so there just wasn't a good option. And so, just opening my own imaging center wasn't going to help because I was going to be in the same boat as those others who weren't getting paid well enough in network to really survive.
Hmm.
So they're operating out of network. But Travelocity and some of those models were emerging at that point in time where people were, taking the unused capacity at other businesses and reselling it at a lower price point. And so went to some of the imaging centers we were reading for, said, can I buy the extra time on your CT scanner or your MRI scanner? And we basically bought the scan from the imaging center. Our radiology group would interpret it and we would bill a single price for that exam. And proved that in the business to consumer space and ultimately started working with health plans. But to do that, we really needed to be national. And so from 2017 to about 2019, we really focused our growth on 50 states, and now we have over 6,000 facilities nationally.
Oh my gosh. Yeah, I was looking at your website. So just to unpack this a little bit. So first of all, very funny that you said you're going to practice and and you were just going to practice and you almost immediately became the business side of medicine as well. So that's never say never, right? I guess that's the lesson there. And then but you saw a problem, you saw opportunity to solve it. So then but just I want to make sure I understand. So basically, you are taking excess capacity, or in other words, you have this super expensive machine that you have sitting there, and it's not being used all of the hours in the day. So you take some of the other hours and you use that machine and you get a better rate. Is that correct?
Absolutely. That's how we do it.
And that's amazing. So and what I think is really cool. So you actually saw this in other businesses, and then you just came up with this idea. And it's a win-win, right? It's win for the patients. It's a win for the people that own the machines because they're getting more leverage out of the machine. But how did you start the first? How'd you say, okay, let's just try this? You just went and just said, hey, look, give me some hours, or how did that work?
Yeah, one of my professors from MD Anderson has an imaging center here in Houston, XL Diagnostics. And so I went to Abe and I said, hey, let's try this. And, nobody had the irony of it as well is our radiology group grew really quickly because we were actually bringing business to the imaging centers, whereas the other radiologists were sitting in the back room just reading studies. And so that actually kind of slowed us down in the first few years because we were growing so fast as a radiology practice.
Wow. Yeah, your growth in radiology actually slowed down your scaling on the other side. That's interesting. So how do you know to scale? How did you figure that out?
I understood that business to consumer is very expensive for healthcare if unless you have a recurring patient. So if you're Kelsey Siebold and you're going to pull somebody in for life and they're going to get, their dermatology done with you and their primary care and
Mm,
their, that all makes sense. For a one-off, it doesn't make a lot of sense. And you don't see imaging centers advertising. You don't see kind of surgical centers very commonly advertising to the public. It's very expensive to get that kind of penetrance. So that's where I really looked at health plans being the means to scale. A TPA, Entrust was the first TPA that I worked with. It used to be an independent TPA here in Houston. And for those of you who don't know, a TPA is a third party administrator. You may think you have a Blue Shield plan, but actually often your employer is renting the Blue Cross Blue Shield network, and an administrator like Entrust, or now they're owned by 90 Degrees, they're processing the claims and running the health plan itself. So Entrust was a
mm.
local, TPA, had a lot of smaller Houston employers, and so that was just the first step, was working with them. But as we've really, even COVID dispersed our population
Mm.
tremendously. But even so, people have kids in college. It really became clear that we couldn't be like HEB and just be in Texas. We had to be national to really make this work with health plans.
So then you hire folks to go out and do that outreach? How did you build that business up to a national business?
Really speaking about healthcare reform, we still don't have a sales team. If we go to a conference, our COO and my sister, who's our in-house attorney, and I go. I'm frequently a speaker at these conferences. I've written a book. It's really organic growth that has, and it's benefits advisors that are starting to work not on a commission basis, which has a conflict of interest, but they're working as
Yeah.
consultants for health plans. And they all see the utility of adding green imaging to these health plans. And so we work with a lot of those advisors.
Yeah, that's I have a couple friends that are in that business, and that's the first thing they said. Isn't it interesting that actually if the insurance person is charging more and they're working on commission, then they make more. So there's not in their interest to actually get you the best price on a health plan. That's a problem.
It's a problem. It's coming to a crest. We're reaching the this cannot be sustained point.
Yeah. So what do you think, if you don't mind me asking then, what do you think what is the next decade of healthcare look like as far as where we're going with financing and plans and all of that?
Well, we're really seeing a surge in independent TPAs and, creating their own health plans, advisors creating their own health plans. I think the health plan of the future is primary care centric. A lot of them are based on some kind of subscription based primary care. The great thing about real primary care is that it should take care of 80 to 90% of what happens.
Hmm.
We've built this because we've diluted down primary care so terribly that it's down to this 5-minute appointment once a year.
Hmm.
And
Yeah.
they put it, and because they're also owned by hospital systems or United Healthcare or somebody else, and they're paid for referrals, basically. That's what they're hired to do. They're sending out all these referrals. My COO's mother, came into one of the big hospital systems. She was out in the suburbs before, went to a primary care visit. Perfectly healthy woman came out with 7 referrals, 7 specialist referrals. That's how they.
Okay.
So if primary care actually starts spending the time with patients and taking care of their problems, 80% of it can happen right there. And
That's amazing.
catastrophic coverage and, in some specialty care and testing along the way, occasionally a surgery. Most of those are elective. Elective surgeries can be done in ASCs much more affordably. And so people are putting the components of these together and creating much more affordable healthcare plans.
Oh, that makes sense. Yeah, and I've had the same experience with I go in for a checkup. The doctor asked me a dozen questions that I could have filled out on a form, and then she said, "Okay, you're good." I got my blood tested. I go on about my day. Like, what did I really gain there? But so I feel you. Okay, so you're building this business and you're growing some demand, and you realize you're going to go across all these states, and you have a relatively small team. It sounds like you're pretty you still stay scrappy. What does your business look like? What does your business look like in the next 10 years then?
I think we have a couple of opportunities in our pipeline right now that blow up our business. I mean, really explode it. We've, we have, as we've bootstrapped, we've done about 30% year over year growth, fairly
Nice.
consistently. And, that is the kind of growth you can sustain. You can easily, I've only been out on my line of credit once over the 15 years. That's the kind
Yeah.
of growth. And it's the kind of growth where I can continue to practice, to create great care for patients. I think we're at a point, we have built this company to scale. I think we're at a point where we can scale it very easily. We know if we add 100,000 lives, how many schedulers we need, how many back office people we need. We've created a model now that I think really allows us to take on some of these very large opportunities. And one of the interesting things, one of the things that I've seen that's really happened in the last month or so and it's seismic, is that we've seen the major carriers, what we call the BUCAs, Blue Cross Blue Shield, United, Cigna, and Aetna, all being willing to process screen imaging claims outside of their own network. So they're saying, okay, this is a legitimate thing. We'll handle the claims. Don't take it outside the plan, which is what a lot of employers have been doing. We'll process the claims for you. Now, they will obviously charge you for processing those claims. It costs an employer about $1.20 to buy $1 of healthcare. And then only 80 cents of that actually goes to the provider. So it's really crazy. They will monetize that. But I think they're hedging their bets. They're seeing enough of these solutions starting to really take traction that I think they're afraid of losing the whole ball of wax if they don't get involved.
Yeah. If they don't get, they want to get their percentage regardless, right? They want to get their cut, and that's the main thing. And if they don't do it this way, they're not cut. That's so funny. I follow the money.
And there again, the broker's not going to lose out on anything.
Yeah,
So all of
he
those
gets
things
his too.
for the existing system.
Isn't that interesting? Okay, so now you're gonna this thing is gonna continue to scale. I think the predictable model is the key, right? So knowing how much support you need as you grow, and then figuring out what the growth is, then you can anticipate that. It kind of works like that for sort of any business. And what I see companies doing a lot is they build a company sort of like, if you've been down to Mexico and you see the houses in these poor places where they got some money, so they built the first room, and then they put the re-rod up, and then when they get some more money, they build the next room. And the problem is that's not necessarily the best way to build a business, right? Because you got to have the right foundation, you got the right infrastructure. So you want to build a 32-story apartment building, we've got to make sure we have all the things in place to be able to do that. That's a different mindset and a different way to look at building a business with an end in sight as well. Like, what's your dream? What's your dream for your business? What do you want it to be?
Just want to take care of as many people as we can well. If it ever sacrifices quality, if it, we really pride ourselves on being patient facing. Everybody who touches a patient, talks to a patient directly, is US based. We don't have any bots during working hours. After hours, we still have some web chat bots, but
Sure,
no
sure.
bots during working hours. I mean, they support, certainly we have automation in the background supporting our people and enabling our people to more readily take care of patients. But, I think Brene Brown did a really good piece on, the future of AI, and, which companies are going to succeed are the ones with people, the ones where people talk to you. Everybody's going to be able to automate. The difference is, can you talk to people and take care of people?
Yeah, so that's that personal touch. And I'm glad you touched on AI because I wanted to ask you about that. But that personal touch, I think, means more in the future even than it does now. And if you can do that and keep costs reasonable, you've literally created a win-win situation,
Yeah,
except
I
for
think
maybe
we've lost a lot of trust in healthcare, and I think it's removing the people. You know, who trusts a bot?
If you waved a wand and you could get whatever you want for healthcare for the United States right now, what would that be? What would that look like?
I think it would be everybody having access to primary care. I think that's the most critical issue that we're missing. It was the first thing I did for my employees was do subscription based primary care. We're lucky to have next level urgent care here in Texas, and they have a subscription based model for employers. And so all of my employees and their families have 7 day a week access to urgent care and primary care through next level, 24/7 telehealth, mental health support, immunizations, basic labs, and basic x-ray. And it's 12 hours a day that they're open. So people don't miss work for doctor's appointments these days at Great Imaging.
That's amazing. So you're practicing what you preach, and that's wonderful. Okay, so in your business, what's one thing as you were building this thing that you kind of were like surprised by that you maybe would have done differently if you would do it again?
I think going into when the Affordable Care Act passed, we went into those health plans, with the idea that this was going to be something that was going to change healthcare and make it better, and it would continue to improve over time the way Medicare has. Medicare is the most successful socialized medicine plan in the world. And, had we just continued to reform the ACA the way we did Medicare, over the years, it could have been super successful. But, it was not, and it was just another health plan for us. And so we pretty quickly got out of that. Left about $1 million
I got
revenue behind, but it was well worth
you. Ooh. Well, the moral of the story is you try some things and you think they're going to go one way, and if they don't, you got to at some point you got to cut your losses, right?
Yeah. And then that was another one, the first Fortune 500 company that came our way. We actually got to the very end of implementation and we walked away from it because, frankly, the major guy was a jerk and was not treating my employees well. And I gave them permission to cut it. And finally they did.
Wow, that speaks volumes to your team, though, right? Like I'm willing to walk away from money because I don't like the way this relationship is going, and you all deserve better. And talk about building culture. That's a great way to build culture is to literally walk away from a deal that's going to make you money for the benefit of your team.
Yeah. And, I think the other thing that I'm really glad I did was I didn't end it. I let them end it and let them
Ah,
make the decision and let them pull the plug.
I love it. That's great. They got to give him the Heisman. That's wonderful. I love that. Okay, one other question, then I'll give you my little speed round of 3 questions, which are really very serious. No, they're not at all. What's the biggest challenge you had in your business thus far that you've overcome, that you're proud to overcome?
I would say the geographic distribution. It's really hard to be everywhere, and we've done a couple of things. We've really worked hard at building out the network. We look at if somebody doesn't book with us because a facility was too far. We will explore that, try to add a facility there monthly. We're reviewing the ones where it seems
Wow.
like we failed because we didn't have a facility, and we're trying to get facilities there. But I think the thing we came up with a really creative way to manage it, and that is we will go out and create a bundle for somebody. We will go out and find an imaging center and negotiate a cash rate on behalf of that person. And so I think I love
Cool.
the problem solving like that. I think that's what has really enabled us to sustain COVID, to sustain a lot of things that have happened over the last 15 years. I think being able to pivot and being able to be creative and find solutions where there doesn't seem to be one.
That's amazing. Okay, thank you so much. By the way, I don't know if I said the name of your company. It's Green Imaging. So just so we get that on the record, that's the name. What a great company you've built. It's so cool, and I love how you stick to your values. Okay, so 3 quick questions. Number 1, if you were an animal, what kind of animal would you be?
A dog.
A dog? Okay, why?
I'm loyal. I like the athleticism of most dogs, like the cuddliness, all of those things.
That's awesome. That's a great one. I love it. Okay, and what when you're not around anymore, what do you want to be remembered for?
Hopefully kindness. I'm an introvert, and kindness doesn't always come as easily to me, maybe as it seems to other people. But it's something that I really strive for and try to pass on.
I love it. And then last, what do you want to be when you grow up?
A better tennis player.
Oh, okay.
Oh, I know, ping pong. That's my next sport.
Ping
A
pong.
fantastic
Okay.
ping pong player.
You're gonna skip the big trend with pickleball and go from tennis to ping pong.
Yeah, and pickleball's too loud. Plus that, the tennis play. We all resent the pickleball players. They're taking over our courts. So
That's funny. I have one behind my house in the park, and you're right. When they play pickleball, there it is louder.
we have one 3 blocks over, and we can hear it.
Oh my gosh, that's crazy. Hey, Dr. Kristen, it was really great chatting with you, and I appreciate all that you've done to really help revolutionize healthcare. I mean, you've saved hundreds of thousands of people money and gave them a better level of service, and built a great team. That's a really, really cool thing, and you should be proud of it.
Thanks so much. Thanks for having me.
Absolutely, it was my pleasure. Have a great day. Think the real takeaway here is, hey, when you see a need that you can fill and you can disrupt the current business model and you can help people, you got to go after that. And this company was one that they founded and brought in family and ran it like a family business, and now it's growing and scaling dramatically. So anyway, Dr. Cristin Dickerson, really smart lady, driven, and classy as far as making sure that she takes care of her employees too.
Liked what you heard? Let's make it real. Schedule your free coaching session today at sugarland.actioncoach.com.